Which of the following factors primarily determines the rate at which the heart pumps blood? A. Stroke volume. B. Heart rate. C. Preload. D. Afterload. Answer: B. Heart rate. Which of the following neurotransmitters, released by the sympathetic nervous system, increases heart rate and contractility? A. Acetylcholine. B. Norepinephrine. C. Dopamine. D. Serotonin. Answer: B. Norepinephrine. Which of the following hormones increases heart rate and contractility, and promotes vasoconstriction to enhance blood pressure? A. Insulin. B. Thyroid hormone. C. Estrogen. D. Cortisol. Answer: B. Thyroid hormone. Which of the following factors increases heart rate by directly influencing the sinoatrial SA node? A. Increased potassium levels. B. Decreased calcium levels. C. Activation of parasympathetic nerves. D. Increased preload. Answer: C. Activation of parasympathetic nerves. Which of the following factors increases stroke volume by enhancing myocardial contractility? A. Increased afterload. B. Decreased preload. C. Sympathetic nervous system activation. D. Parasympathetic nervous system activation. Answer: C. Sympathetic nervous system activation. Which of the following factors decreases stroke volume by reducing the amount of blood in the ventricles just before contraction? A. Increased afterload. B. Increased preload. C. Decreased contractility. D. Activation of parasympathetic nerves. Answer: D. Activation of parasympathetic nerves. Which of the following conditions increases preload and subsequently increases stroke volume? A. Hypovolemia. B. Hemorrhage. C. Exercise. D. Vasodilation. Answer: C. Exercise. Which of the following factors decreases cardiac output by reducing both heart rate and stroke volume? A. Sympathetic nervous system activation. B. Increased preload. C. Increased afterload. D. Parasympathetic nervous system activation. Answer: D. Parasympathetic nervous system activation. Which of the following factors increases cardiac output by increasing heart rate without affecting stroke volume? A. Increased preload. B. Increased afterload. C. Activation of sympathetic nerves. D. Activation of parasympathetic nerves. Answer: C. Activation of sympathetic nerves. Which of the following factors decreases cardiac output by increasing the resistance that the heart must overcome to eject blood into the systemic circulation? A. Increased preload. B. Increased afterload. C. Activation of parasympathetic nerves. D. Decreased contractility. Answer: B. Increased afterload. Which of the following mechanisms increases heart rate by directly influencing the sinoatrial SA node? A. Release of epinephrine from the adrenal medulla. B. Activation of parathyroid hormone receptors. C. Stimulation of beta-1 adrenergic receptors. D. Inhibition of alpha-1 adrenergic receptors. Answer: C. Stimulation of beta-1 adrenergic receptors. Which of the following hormones increases heart rate and contractility by binding to beta-adrenergic receptors on cardiac muscle cells? A. Insulin. B. Aldosterone. C. Thyroid hormone. D. Antidiuretic hormone ADH. Answer: C. Thyroid hormone. Which of the following conditions is most likely to result in an increase in cardiac output through an increase in stroke volume? A. Sympathetic nervous system activation. B. Activation of parasympathetic nerves. C. Decreased blood volume. D. Decreased systemic vascular resistance. Answer: A. Sympathetic nervous system activation. Which of the following factors primarily determines the amount of blood ejected by the heart during each contraction? A. Preload. B. Afterload. C. Contractility. D. Heart rate. Answer: C. Contractility. Which of the following conditions increases preload and subsequently increases stroke volume? A. Hypovolemic shock. B. Hemorrhage. C. Vasoconstriction. D. Increased venous return. Answer: D. Increased venous return. Which of the following factors increases stroke volume by enhancing ventricular filling during diastole? A. Increased afterload. B. Decreased contractility. C. Increased preload. D. Activation of parasympathetic nerves. Answer: C. Increased preload. Which of the following factors decreases stroke volume by reducing ventricular filling during diastole? A. Activation of sympathetic nerves. B. Increased afterload. C. Decreased preload. D. Increased contractility. Answer: C. Decreased preload. Which of the following factors decreases cardiac output by reducing both heart rate and stroke volume? A. Activation of sympathetic nerves. B. Increased preload. C. Increased afterload. D. Activation of parasympathetic nerves. Answer: D. Activation of parasympathetic nerves. Which of the following factors increases cardiac output by increasing both heart rate and stroke volume? A. Increased afterload. B. Activation of parasympathetic nerves. C. Decreased preload. D. Activation of sympathetic nerves. Answer: D. Activation of sympathetic nerves. Which of the following conditions increases afterload and subsequently decreases stroke volume? A. Vasodilation. B. Decreased systemic vascular resistance. C. Activation of parasympathetic nerves. D. Increased blood viscosity. Answer: D. Increased blood viscosity.